Today's Talk365TV's Talking Wellness is brought to you by Fairbanks Art of Plastic Surgery with wellness team expert Dr. Grant A. Fairbanks.
Hey everybody, welcome to our Talking Wellness series. I'm Holly Love, and today I am back with our wellness team expert Dr. Grant A. Fairbanks from Fairbanks Art of Plastic Surgery. Hi, Dr. Fairbanks.
Good morning, Holly. How are you?
I am doing so good, and I am so excited about today's topic. So we're going to dive right in because we are talking all about breast augmentation. So we are going to review all the options, who's a good candidate, all the things that you want to know before you go in and have a consultation about having this done. So let's start with candidates. Who is having this procedure done?
It's typically a woman who is unhappy with the size of their breast. They feel somewhat self-conscious, wants to be able to fill out a swimming suit a little better or a blouse. Often it will also be the woman who's had children and has found that she's feeling deflated after breastfeeding and feels that she would like some more volume, and they just want to feel more feminine. And so breast augmentation or breast enhancement is within the top 3 procedures in cosmetic plastic surgery. It is very popular and it does make a lot of people happy.
So beyond that, is there an age limit for who is able to get that done?
Typically I like to start at the age of 18 and older. I've even done breast augmentations on women in their 70s. But typically those are people who've already had the breast augmentations and we're replacing them.
I see. Well, let's talk about the types of augmentation you can have, because there is silicone, there is saline, there are different sizes. How does that all work?
Well, the silicone breast implant is the most common way of augmenting a breast. And the FDA finally approved these in 2007 for cosmetic purposes. The new silicone implants are safer than they were, say, back in the 80s when the shells were very thin and the gel was actually more liquid. Those implants would rupture. Nowadays, the implants are actually have a thicker shell and the gel is more cohesive. So these don't leak as much or as readily as the older implants. And the FDA recommends that after 3 years that the patients start doing MRIs every 2 years, because the breast is not going to deflate. And really that's the best way of determining the leakage. And it tends to be a favorite amongst patients. They feel that it feels a little more natural, and we've been using these for breast reconstruction all along, even during the moratorium that started in the 1990s. So the silicone breast implant is now the most common implant that we use nowadays. But your alternative is a saline implant, which is the silicone shell, but then once we put it in the body, we fill it up with salt water, so it looks very much like a silicone implant.
Just more hard.
Well, some have told me it feels like a water balloon. Some think that it feels very similar to the silicone implants. But when these fail, these deflate, come back to this, and then we know that it's deflated because the breast is smaller.
And you're saying with as strong as they are, typically it's not like they pop, it's more that it's just over time they get a crease and then they rub and then they just get a small hole or a thinning.
Yeah, there's a thinning in the shell.
Well, let's talk placement, because I know there is under the muscle and over the muscle. There is different places you can have an incision. What do you suggest for your patients?
My preferred method is under the breast. We call it an inframammary incision, which is underneath the breast. Through that incision, I can see better the anatomy. I feel that I have better control with bleeding and protection of the nerves that provide sensation to the breast. Other options include right underneath the nipple. Some are through the armpit or axilla. And those have had some good results. But the thing is eventually the implant will have to be removed.
Right.
And so typically when it's replaced, it'll be removed through the inframammary, and then it has to come out that way. And so might as well start with it from the beginning. Now, the original breast implants were placed on top of the pectoralis muscle, right under the breast gland. Eventually, we started putting them under the muscle. One of the reasons for that was to hide the implant itself.
The rippling.
The rippling
I've
and
seen
so forth.
Horrible ones.
The other reason was to actually massage the capsule around the implant to keep that soft so that we don't have the hardening of the capsule, which can happen occasionally. That's called capsular contracture.
And the scar too, you can hardly see it. It falls right under the fold. It's nothing to be concerned about. You would have to have a microscope basically to know that it was there.
I haven't had any patients complain about them.
Well, so beyond saline and silicone, what else do we have?
Well, the other option, I think you're alluding to fat grafting. Fat grafting for breast augmentation is becoming more popular. It is a very good procedure, and it is the more natural way of doing your own breast augmentation. So what do we do? Liposuction, breast augmentation, well, they're both within the top 3 procedures in cosmetic plastic surgery, so why throw the fat away?
Exactly.
So little liposuction of the hips, the thighs, the belly, and then once we process the fat, we then put it into the breast through 2 port sites, one on the lower inner portion and the lower outer portion. And so the incisions on the breast are very small nicks. And it's through those small nicks that we're able to put the fat through with what we call a cannula. We put the fat tissue under the breast tissue and over top of the breast tissue, and we do it in a way to hopefully have a better blood supply to keep it alive. So the size of incisions for fat grafting are significantly smaller than those for silicone or saline implant.
I'm gonna say how many of you have not said, why can't they just take it from here and here and here and stick it in here?
And the answer is yes.
I love that answer, yes, but there are some precautions because I can't donate for you if they're just too skinny to have their own, but you do have to have a certain amount of fat.
Well, the limiting factors, there's how much fat the patient can give me. Well, give themselves.
And how many times do they need to have this done?
Well, this is a procedure where less is more, because the fat that you transfer from, say, the hips to the breast needs to have a blood supply to stay alive. And if you put in too much, there's a certain amount of fat that won't survive because it doesn't have a blood supply. So typically the patient will have at least 2 and sometimes 3 procedures to finally finish up their ultimate goal. Now there are some patients who hardly have any breast tissue. And in order to give them more of a natural breast look and feel, often we will do the fat grafting into the breast and then later on put in a smaller implant. So they have more soft tissue over the implant. So it really is all dependent on the patient themselves.
Well, let's talk size because I think that is always a very big topic of concern for people who are wanting this. Like, what size should you be? How big? How little? Is there any kind of artistic measurement? You with your artistic background in sculpting, I would imagine you know exactly what a body needs to look great.
Well, yeah, and I appreciate that. Personally, I like to see somebody who's proportional, and I go over proportions with my patients. So for more petite women, a smaller implant is what you want, and if you're taller or broader chest, you want the bigger one. It's the width of the implant. However, the size of breast is really individualized. There are some women who would like to be smaller. These are especially the women who are more physically active, more athletic, and yet they still want to feel like they can fill out a swimming suit appropriately.
Have a little something. They don't necessarily want to be double Ds.
That's correct. But then there are the ladies who want to be a little larger. And that's their prerogative. And so it's really an individualized choice for my patients.
Well, let's talk recovery because I imagine recovery for a typical silicone or saline breast augmentation versus the fat grafting breast aug has a little bit of different downtime. So let's talk, what can people expect from the results?
For the implant breast augmentations, it can be a little sore. Being placed under the muscle, it stretches the muscle, but you know, it's tolerated really well. And so I ask people not to do any heavy lifting or strenuous exercise for about 6 weeks. And I find that I get good results with my patients in doing that. With the fat grafting, it's pretty much the same. I ask them to be very careful with the breast, especially for the first couple of weeks, because that's the time when we're developing a nice blood supply to keep that fat alive. Now, more of them complain more of tenderness where the fat was removed in the areas of liposuction and not as much pain in the chest.
Do you recommend massaging or anything like that? Is there any special garments? How does that all work?
After surgery, I'll give them a surgical bra. After the first week, they can start wearing sports bras because they're usually very comfortable. And then after about a month, they can wear any bra they want.
So what about when you come in 10 years later to have a redo? What is that procedure like for someone?
It depends on the amount of time that the implant's been in place. If the implant is ruptured, then we can just replace the implant. If the capsule that's around the implant, the capsule is a covering of scar around the implant. If that is still nice and soft, we can just replace the implant. If the capsule has developed some kind of a shell, like a calcium deposit, which they will, especially for the older implants, we will remove that capsule and then replace the implant.
So beyond a breast augmentation with silicone saline or using fat grafting, there are other procedures to revive, renew, mommy makeovers. There's a lot of things you can do when it comes to a breast makeover. So let's talk about a few of those.
Well, first off, the breast is one of the more dynamic structures of the female body. So they get larger, they get smaller, they're firm to begin with, and they get soft and saggy later on. It all depends on the patient themselves. So with regards to a breast lift, those are patients who are a little bit older, or the breasts have been larger than smaller and they've sagged. And this is for the woman who likes the size of her breasts in a bra, but she just wants them lifted. Now, for breast reconstruction, we've been finding that fat grafting is very helpful, especially for some of those who have had radiation therapy. The fat grafting will help soften up the radiated tissue, which is hard and firm. It's been very nice for that. Of course, for breast reconstruction, we also offer implants as one of their options. For breast reduction, those are for ladies who have a significant amount of breast tissue that is really causing problems with regards to neck pain and back pain. Once they have their reduction, one of the common comments is, "I can't believe I waited so long." But it's a wonderful procedure where we both reduce the size of the breast and we lift the breast. The technique that I've chosen is one that I feel is important to maintain the breast tissue, so that if a young woman would like to breastfeed, she can still do that. Now, she may have to supplement, but at least she can try and have that experience.
Right.
The idea is to give a breast that actually looks like a breast and has the same proportions and so forth. And we find that the scars are very acceptable. In fact, I have not had any patients who have been unhappy with their scars.
So the mommy makeover, what does that entail?
Well, the mommy makeover is breast surgery to lift and sometime augment the breasts. It'll also include a tummy tuck or abdominoplasty to take away a lot of the stretch marks and revitalize, if you will, the tummy because of all of the loose and crepey skin. And those are the two main areas that are addressed in a mommy makeover. Now, some will go further and say, well, I want something done with my thighs or my arms. And it's really an open menu. It just depends on the patient's concerns.
Well, now for those people out there who are interested in having this done, what's the next thing for them to do?
Well, the easiest thing is to call us. You can find a telephone number on our website, fairbanksmd.com, and call and set up an appointment.
And for a limited time, if you are online and you enter promo code Talk365TV or you mention Talk365TV, you will get that consultation for free, but not for long. So definitely jump on that while it's still available. It's a huge value. And the consultation process, as I mentioned before with this guy, is absolutely phenomenal. He will thoroughly go through everything that you need to know, want to know. As I mentioned, he is a fourth-generation artist. He brings this combination of artistic skill with advanced surgical techniques, and you couldn't ask for a better advocate to walk you through any procedure. Dr. Fairbanks, thank you so much.
Oh, thank you, Holly. Appreciate it.
All right, everybody, don't go anywhere. We'll be right back on Talk365 TV right after this.